Doctors and nurses of Reddit, what's the worst thing you've seen on the job? I am an EMT, so not a doctor or nurse. But this story makes even my surgeon friends nauseous. A few years back I got a call over my radio saying that there was a trapped woman in her home who needed medical assistance. I was the first responder, so I go into the house with my bag and immediately I'm hit by a wall of stench. Now, this odor is not just the, oh god, you need to air this place out, odor. It's the sweet mother of God. I can taste it. It's in my eyes. I have to burn the clothes I'm wearing. Odor. Obviously this woman was some kind of hoarder. There were cats everywhere. They were just sitting on top of crap that had piled up in the house. There was cat crap on the walls, the floor. I saw families of cockroaches skittering around. Disgusting. So I called out to identify myself as a paramedic and I hear this woman calling me from down the hallway. As I pick my way through the house the odor just gets worse. It was like someone covered themselves in baby vomit, and then rolled around in a field of rotting flesh. I come to an open door and lo and behold there is the woman. Or should I say whale. This woman had to weigh at least 450 pounds. She was naked, covered in crap, and wedged between her toilets and her bathtub. I nearly lost my goddamn mind. The desire to vomit was so intense. I asked her what happened, donned my gloves, as well as a mask, and started to think of how the frick I was going to get this woman out. I'm not small, 5'8", 155 pounds woman, but dang I'm not Hercules. It's about this time that more EMTs start arriving, as well as a few cops. This rookie cop comes racing in, sees this woman covered in crap, and vomits right onto her. This sets off a chain reaction. The woman begins to vomit. More EMTs and cops come in, and everyone is freaking vomiting. I'm standing in an inch of vomit juices that is now mingling with crap, and I'm just trying to figure out what to do. Turns out we had to call the fire department, get the jaws of life, and rip the toilet out. We didn't have a stretcher that could support this woman's weight, so we had to improvise. When we got to the other doctors and nurses looked so incredibly disgusted. Now, keep in mind we're covered in crap and vomit, with that horrible odor of the house clinging to us. We had to go into a decontamination room to get cleaned. Worst day ever. You have officially made me so happy I work with dead people and not live ones. Got another one for you guys. Dad's a dentist. One night we get a call at home from the local asking if my father is willing to come in and deal with a patient because, well, they have no idea what to do with this woman. My dad is a rather stand-up guy, so goes and opens his practice to treat this woman. I go along with him and help set up the room. An ambulance pulls up and wheels this elderly woman into the clinic. From the get-go the first thing that hits us is the smell. Her face is bandaged up pretty well, and we can see blood seeping through the gauze and all down her shirt. Double gloves, double masks. My dad dives in. She has something penetrating her lip. It's mustard yellow, and has the consistency of rock candy. He plays with it a little bit, and a large chunk breaks off. What's attached is 4 of this woman's teeth, or rather, the decayed remains of her teeth. Apparently, this 78-year-old woman had never brushed her teeth a day in her life, and what had penetrated her lip was an obelisk of plaque. He continued to clean away what he could, but the plaque buildup was so massive that she had literally rotten away all of her teeth and most of her gums. One spot was abscessed clear down to her jawbone. To this day he kept the chunk in a jar in his office, and scares little children into brushing their teeth every day. I keep telling him he needs to do a case study and submit it to a medical journal just for the lulz. I suddenly wish I had my toothbrush with me right now. Guy came in with severe abdominal pain. Turned out he had painful hemorrhoids which had led to him being too scared to take a dump for 1 month. He couldn't tolerate any of the normal treatment, laxatives and enemas, so he ended up being taken to theater where I, the most junior member of the on-call surgical team, had to claw out this monstrosity of a turd with my fingers. It was this dense mass about 4-5 inches wide that felt like hardened clay and smelled exactly how you might expect a bowl of crap that's been brewing for a month to smell like. Took a good half hour before I managed to clean him out, all while the nurses tried to stand as far away as possible and my seniors pee themselves laughing at my horrified expressions. Till that you can go without taking a crap for a month. Of course it'll be painful as heck but it's doable. RN here. And I gotta say, as horrifying as these stories are, I am laughing as much as retching. Guess I've been a nurse too long. Anywho, here's my fun tale. Had a very obese man, 400 plus lbs, with a swollen scrotum. No kidding, his ballsack was the size of a basketball, just dangling there between his legs. The gross part was when he went to sit down. Yes, he could walk a few steps with lots of help. He would grasp the handlebars of his walker and start swinging his hips back and forth, to get his ballsack swinging. Then, at just the right moment when his basketball-sized junk was out in front, he'd sit down quickly so as not to crush anything. I pride myself deeply in being able to keep a straight face through that ritual. I never once saw a male nursing assistant who didn't choke with laughter watching him do it. Maybe not the grossest story here, but it might at least not give anyone nightmares. Mom in the air. Guy came in with a pencil and a straightened cloth changer up his urethra. Both stuck good. Apparently, the pencil was for fun and the hanger was to attempt to dig the pencil out. I don't understand that method of pencil removal. Saw a lady who had flown in from another country to have US doctors help with her breast cancer. She had a metastatic tumor on her arm that was the size of a bagel and smelled of necrotic tissue. Her chest wall was replaced by tumor and you could see her rib cage. Her family got mad that we couldn't just cut the tumor off her arm. The whole smelled like rotten flesh. Happy holidays everybody. In another of these threads, someone posted a similar story about a woman with a rash on one of her breasts. Yeah, super advanced breast cancer. When they lifted the breast, they could see bone underneath. Nursing student here. Had to insert a catheter into a pretty obese lady. Saw a black string hanging from her vagina. I asked her if she had a tampon in and she said, "Oh, I hope it's not still there." I ended up having to pull it out and the stench will be with me forever. Not to mention the white pus and brown slime covering a now black tampon. Apparently she hadn't had a period in months, so who knows how long it was in there. My vagina just went further into my body out of pure horror. When I was doing my OB-GYN rotation, we had a woman come into clinic that had a condom in her vagina. Apparently it came off during sex with her boyfriend, but they didn't take it out, and she waited like 2 weeks to come in to get a doctor to remove it. She stunk the entire office up so badly. Jesus no. Most disturbing thing I can remember in recent history was someone with cysticercosis, tapeworm infection of the brain. I got a script for a dewormer with a ridiculously high dose. I called the doctor thinking it was a mistake and he told me what was up. We both agreed there was very little chance of it working, but he said there were absolutely no other alternatives. Now I have a headache, and I cannot convince myself it's not the brain worms. Worked on a rural EMT team during summers off from college, and responded to a drunk driving accident. When we arrived, I thought clearly this guy has to be dead, mostly due to the crumpled car that the firefighters had cut apart. This guy must have been drinking a lot, because there were beer bottles all over the place, with broken glass shards all lodged in his skin. But that wasn't the worst part. He had the remnants of a beer bottle lodged in his neck, which in and of itself wasn't too bad. I've seen worse. Except the bottle was the only thing keeping his head attached to this body. The man had decapitated himself. I'll never forget seeing his eyes moving and mouth attempting to speak, or the sick sucking sound that were emanating from his neck as he struggled to breathe. Obviously, he did not survive the night. A homeless paraplegic woman was brought into the ER for pneumonia. We had to strip off all of her dirty clothes and put her in a hospital gown. As I took her pants off, I noticed a cockroach, which I thought was weird. As we took her panties off, out came the swarm. Roaches had nested in her vagina and she couldn't feel it because of the paralysis. We have a winner. I've been an RN for over 5 years. The story that sticks out in my mind is this elderly woman who had colon cancer. I was newly pregnant. Very bad morning sickness all day long. She was on the verge of death and started vomiting the contents of her bowels. When the bowels stop working, the stuff can come up out of the mouth. We had to get a tube down her nose ASAP to start sucking the stuff out so she could no longer puke it and die in peace. Those are hard moments. Watching someone dying and you are almost physically unable to help them. And usually I pride myself on being able to handle the most disgusting of situations. Someone had to come in and help me, thank goodness, and we got the tube down her nose. Sounds like an argument for quietly increasing the level of morphine under the approval of family. My mom worked for a urologist. She came home with the story of this guy that had a master lock attached through his penis. He misplaced the key and was looking to get it off. He also rode his bike to the office. They had to refer him to the hospital to remove the lock. Not as gross as some stories I've read, but this is one my mother told me after a night working there. A guy came in with his penis broke sideways. He said my girlfriend got a little too excited. Another one where my dad was driving an ambulance. It was time to remove a cast for a very large woman who broke her leg. He was sent to pick her up. She never got up from her chair since getting out of the hospital. For months she crap and pee herself in her recliner. My mother is the one who removed the cast. The cast was full of cockroaches and roach eggs. They said the ambulance and the exam room smelled for days. Student psychiatric nurse here. While on a ward for the elderly suffering from dementia, I had one experience I will never forget. I was helping a client eat when I get a call from one of the rooms in the corridor. The client I was helping was pretty much done, so I went to investigate, hoping that it wasn't a fall as the call was from a room belonging to a very unsteady lady. Oh god, how I wish it were a fall. The lady who called, let's call her Betty, was in the corridor outside her room. The first thing I noticed were her hands, covered in feces. Oh Betty, did you have some trouble in the bathroom? Hey, it happens. Sometimes when you're older you may be a bit shaky or confused, and I'm not one to judge the unwell. Let's get you washed up then. We move into her bedroom when the smell hits me. For a second I just stare and try to take in what has happened. What follows is my brain process. Traces of feces are everywhere. On the walls, on the wardrobe, on her clean clothes, on her bed, on the door. That's okay, we can clean this. But I can't see any major movement from which it would have come from. But wait, there's something on the floor. As if someone had defecated on the floor and picked it up. Yes, there's slide marks from someone, obviously mauve. Oh my god. She has shat on her dinner plate. I saw, on her bedside table, a plate piled high with feces. I'm not kidding. At least 6 inches on top of the food. And I just stood there and stared for what felt like an eternity. More like 5 seconds I guess, before calling someone to give me a hand. Perhaps it was a political statement about the state of the food in the hospital. I don't know. Regardless, I now have the best party dinner table story. Like this video and this good boy will play you a nice song. Like and subscribe, you magnificent person.